a site that would be convenient for rural patients, because I think is it 40% of your patients are from outside Regina, Dwight? I think it's, so it would be something that you would plan to make it very convenient for rural patients, many of whom, I need not tell you, can be intimidated by large hospital environments. Imagine that facility for a moment with the capacity to electronically schedule the numerous tests and record all patient information and transactions, which you may then carry on a smart card. Only then, only at that point, will your doctor be able to get the information as quickly as your friendly banker. Imagine this facility by 2012, including a learning center that develops the skills and competence of trainees before they apply their know-how in treatment clinics or in operating room settings. Now picture by 2012, it's not a long ways off, picture this, a growing number of medical students, other healthcare professionals, choosing to spend their training years in Regina because of such a state-of-the-art facility that's available. Just picture what the community response would be. Picture how this concept of delivering care would resonate with the donors, generous donors, when we know that they would prefer to invest in initiatives that bring pride to their community and enrich the quality of life around them. If Saskatchewan is going to find solutions to what needs fixing, it's going to take a whole bunch of sweat equity by healthcare leaders like Dwight, board chair, boards, the leadership and the medical staff, and leadership throughout the healthcare professionals. If it takes a village to raise a child, it will take all of you to build a healthier way of life for Saskatchewan people. That really means that biases, and there are a lot of biases, the self-interests that are embedded in healthcare, and the posturing that takes place. All of that must be set aside so that a collective giant step can be taken to identify how the interest of the patient can take precedent at every patient interaction, every future contract negotiations with unions, and every debate with policymakers. It will also have to take leadership, or it calls for leadership, at the community level. The community, to me, is not just simply a dot on a map. A community is people like you. I think I'm going over my time, Judy, so I'm going to just quickly finish. Let me just conclude by saying that the people of this province care so passionately about Medicare. But in turn, they want Medicare to care about them. So what does this all mean to a group of people in this room? It means that I and you and we have work to do. Let's not disappoint them. And the choice is ours at the end of the day to put the patient first. So thank you very much for your time.